Hello and welcome everyone. In this lecture we're going to be talking a little bit about logic models. Now when we think about programs and program development, it's actually pretty intimidating. It's a big project. There's a lot of different elements that come together to do it. What logic models are essentially structures for thinking systematically through what you're going to do in your program. Now, the advantages to these logic models are substantial. Most research suggests that that programs that actually have a distinct model and framework for doing them actually tend to be substantially more successful than ones that are done in a more ad hoc way. And that perhaps isn't surprising, but it's notable that you can substantially increase your likelihood of success by going through this exercise of thinking logically through what you're going to do. So the elements that this is useful for are, first off, planning the program effectively, thinking through all the elements. Secondly, you also have to think about how you would actually explain this program to other people. And having a clear model with the logic laid out is very helpful for transparency and working with your stakeholders. Then as you're going forward, you actually have to implement that program. You have to do something with it. And as you're going through that, being able to clearly explain it, monitor, and watch the different components to a program is also a handy thing. And then finally, a program is more likely to be sustainable and continue to be used if you can actually have a good evaluation plan. And what logic models do is they show you the points at which you can add evaluation into your project, and so that you're planning that evaluation from the very beginning. All right, so there are a lot of different logic models out there. They all tend to do similar types of things of thinking about, what is the situation you're dealing with, what do you have to get to make this project work, what activities are you going to do, and then what types of outcomes would you expect from this project. There's different ones available with different types of resources, many more than are listed here. The one that I'm going to be talking about in this lecture is a Wisconsin model. The reason I use that is I've taught this class multiple times, and in other cases I've offered students choices of different models, and they tend to pick this model. So it tends to work pretty well for students. So I want to just clarify the distinction between a logic model and a theory of change, and the model that you have for a theory of change. So the way I'm going to be talking about in the class is the theory of change is more a very simple, direct explanation of what's happening in the program, how you're going from one state to another, all right? And this is intended to be a very brief explanation with limited text that anybody can look at and pretty quickly understand what you're doing. The logic model is going to be a more complex assessment of this. It still is intended to be understood fairly rapidly, but you're thinking more in terms of a 2 to 5 minute view of it would allow people to understand what you're planning to do. Okay, and the logic model is a little bit more distinct in how it breaks up the different elements to your program in terms of the situational elements, inputs, outputs, and outcomes in this case. So that's the distinction between them. Now, sometimes those terms can sometimes be come together. So, and sometimes you'll have theory of change sometimes be integrated into the logic model in various different ways. For the purpose of the course, we're using the definition of the theory of change being that short model, and then the logic model being the more complete assessment of how the program works. Okay. So the logic model that we're looking at here is Wisconsin model, which was put together by the University of Washington Exchange. And they have a pretty complete documentation around this that is essentially designed as a training module that you can look at. Now, the overall components to this are describing the situation that you're dealing with, what the priorities of you and your stakeholders are for dealing with that situation. Then you'd also think about the inputs to your project, what you would need to put in, the outputs, and those would be the activities, so the things that you're going to do, and then the participants, who's going to be doing them, what is the reach of that program to individuals. or organizations. And then we have the outcomes. So here we're thinking short, medium term, and long term outcomes or impacts. And that's trying to figure out what do we expect to come out of this program. You also would look at the assumptions of the program. So what are we assuming is going to be happening here? And the external factors that might influence the success of your program. And these are typically factors that you may not have a lot of control over, but that you need to be thinking about if you're going to carefully plan your program and be aware of potential risks to that program. The final one, which I will be discussing more in a different lecture, is also the evaluation component to a model, which is also looking at what are the things that you would actually measure at these different points throughout this model to actually show whether or not your program was working. All right, so you can actually use this structure and have a model where you can fill in for each of those components what you think the different elements will be. And that can be actually a very useful visual tool for working with your audience to essentially gain buy-in and have everybody on the same page about what you're doing with your program. So there's some preparatory work that you do in developing a model. And for the Wisconsin model, we're looking at the situation, and that's looking at the general situation that we're addressing or the issue that we're addressing, the priorities, and that's really focusing in on what your stakeholders think should be prioritized in terms of what they need based upon that situation. Then you have the assumptions that you're dealing with and the external factors, assumptions about the program, and how it will actually work, because you want to know what you're making, what assumptions you're making. And the external factors, again, being the outside factors that could influence you. So I'm going to go through them in a few seconds. But first off, I want to just say a few words about writing the logic model. So when you're writing this model, the goal is for the reader to understand quickly, right? So you are going to have a delicate balance between avoiding having excess information, things that they don't really need to know, but also providing them the information that they do need to know. So there's that balance between being too wordy and having it be something where people just get lost in it. They don't understand things because it's too much text, versus having it to be too brief and people don't understand what you're trying to get across, right? Now, when you're doing this, you can assume sort of general knowledge for somebody working in your institution and field, but you shouldn't necessarily assume expertise in a particular area, okay? Also, when you're writing these logic models, you can use abbreviations so long as it generally be understood by your audience. It can be nice, especially if it's information that people may or may not know, to have the actual full term and then an abbreviation at least once in your model. Sometimes that isn't practical given the types of information you're trying to add in. But, you know, it is a strategy that can be helpful for the reader. All right. So when we think about the situation, we're thinking about what you've done to look at the literature that's there, different types of institutional data that is available, what your stakeholders have identified as being important issues for your institution or the challenge that you're facing, your analysis of that problem, and the different assets that you have to deal with this problem. So in terms of looking at the situation statement or sort of assessment, you'd be looking at what is the problem, and that can be sort of some data about why this is an issue, a health issue, or a challenge for a healthcare system, why it's a problem, how many people are impacted, die due to this, what you know about how that looks at your institution, who is actually impacted by this, who is the end, who actually ultimately has a problem as a result of this, right? Whose lives does this impact? Who generally has a stake in this problem? Those would be your stakeholders. What do we know about the problem or issue and people that are involved? So again, here being a little bit more specific to your institution. What do we know from research and experience about the problem, and what does it suggest? And what assets do we have? So these are kind of overlapping factors that we could consider in sort of describing the situation overall. Now, all these elements don't necessarily have to be in the situation element of your logic model, but this should be probably talked about in a paper, or you certainly should have thought about these different types of questions as you're thinking about understanding the situation that you're facing. One comment about assets: it's nice to have at least some recognition of the fact that your institution or where you work has assets, to not only view this only as the situation as only being a problem, but also at least including one thing that sort of describes the strengths of the institution that you're in. So strengths can be related to groups or individuals, association. It could be financial strengths, environmental strengths. It could be an organization, evidence-based practice organization that's working on this. But just calling out that we're not only looking at problems, we're also recognizing that we have strengths as we go into this. So just something to consider, at least putting something in there to acknowledge these strengths in an institution. So as we're thinking about the situation, don't be too quick to assume that you know the cause of why a situation is occurring. The risk here is that sometimes we satisfy ourselves with sort of surface explanations for why something is a problem. And that's sometimes because that's just the thing that's most obvious to us. But there's real value to stepping back and taking a critical approach to this and actually asking why that situation occurs. What is the root cause or the thing at the basis of this problem that you're facing? Now, you may not choose to address that root cause. You may choose to influence more downstream impact. But it's helpful to really ask yourself carefully and go through the exercise of thinking about why this occurs, because sometimes by doing that, that will actually reveal to you that there's a different approach to actually dealing with this problem than you initially thought. Another thing that sometimes is a problem here is for a situation is you don't want to define the problem as being the absence of the program that you want to offer. So the program is supposed to be the answer to the problem. It's not, the problem isn't that we don't have the program, right? You need to define what your outcomes are, and the outcomes that you want to achieve, the problem and the issue that you want to address, are what should drive what the solutions or the programs are that you develop. You should also note that situations change. With a logic model, you can update and adjust that logic model as time goes by. So keep that in mind, that this is something that we would need to update as a program evolves. So how do you write about a situation? So here's a few examples, but you're mainly looking at short statements that just provide context about the project that will be useful for someone who's reading this, trying to understand what you're doing. All right. And I just have a couple examples there that you can look at that, might be the type of thing that someone might put in. Now let's move to the priorities element. So the priorities are really trying to think about what are you, based upon what the problem is that you're addressing, what are you prioritizing as being the important things to do, to address. All right. So this is going to be determined largely based upon both your opinion, but also your opinion along with your stakeholders, the various different people that you'll be working with that care about the problem that you're dealing with, the situation that you're dealing with. And the priorities will vary. They're going to vary based upon what your institution is trying to do, what resources you have and expertise you have, the history of having tried to deal with this before. There's a range of different things that will determine this. All right, and that's going to be a conversation between you and your stakeholders. And as you do this, if you're thinking as you actually do this in the context of creating a program, in actual implementation, you'll have to figure out how you'll actually determine what are the priorities. Are you going to be voting on them? What makes a priority is rising to the top of your list? You also need to think about who's going to be your stakeholders who will actually be making those priorities. It isn't always the case that all stakeholders have to be involved in that, but it's often wise to include a range of different people who are really interested and knowledgeable about this issue. And and also thinking about whether or not the priorities are connected to the desired outcomes. And we're going to talk about that more later, but priorities really do connect very closely to the outcomes that you're hoping to achieve. Okay. So when we're thinking about projects that we're developing in this course, or generally speaking, sometimes we are doing it before we're actually ready to talk about this with other people at our institution, or maybe we're even proposing a project that's hypothetical. We're perhaps doing it for an institution that we used to work at, where we saw a problem that we wanted to talk about and think about how do we carefully address this using and plan to deal with this. So when you can't deal with actually work with your stakeholders to set priorities, you can set priorities partially based upon your understanding of what your stakeholders actually would want. And you can do a stakeholder analysis, which is your assessment of what they need and would perceive. Now, there's risks to doing this. Obviously, you can't substitute your own opinions of somebody's opinions for their actual opinions, right? But you can do that to some extent early on in a project to sort of begin getting it in the right direction, and also forcing yourself to think about the program from other people's points of view. All right. And that's really important because when we come at programs, it's very easy to just default to our own perspective on what the problem is and what the solution would be. All right. So this is quite helpful to do to have those other stakeholders involved. Sometimes in this case, it's helpful to pull back and think about what are the larger values that you could talk about in terms of these priorities for the institution, in terms of the values that they would have for patient well-being or other factors like that, and perhaps customize those values to the situation. And that might help based upon your assessment of the stakeholders and what they would want and sort of what the institution probably wants to describe what your priorities would likely be for this project. All right, so how would you write this? You would write these priorities in more of an aspirational way. So sometimes these priorities will be a little bit more specific, where you'll say, and that would be situations where you actually kind of know exactly what you need and what the priorities would be for your institution, or they could be a little bit more values oriented and a little bit more broad about say quality of care or quality of life or things like that, right? So here, so this is just a way that you could write those out. Again, being fairly brief, but giving the idea of what the values and desires are, the priorities are for this institution going forward. All right. Another element in that early work is thinking a little bit about what assumptions you have about how your program will work based upon your theory of change, right? So this is, the goal of this is to identify the things that you are assuming to be the case, all right? Now, the reason you want to know what your assumptions are that sometimes your assumptions are wrong, and it's worth airing those assumptions to your stakeholders and to other people looking at this so that if they don't believe that these assumptions are correct, that you can have a conversation about it before you invest all that time and energy in trying to create this program, right? Remember, programs are big investments, and being clear about that and understanding the risks of going forward with it is a really valuable thing to do from the get-go. All right. So here we're thinking critically about our own ideas and clarifying our assumptions in them. So again, here you're going to be prioritizing the key assumptions. And these are the assumptions that you think are most questionable or have the most risk or are most likely to be brought up in terms of people critiquing your program or your ideas. Or they're just the most important ones that are really essential to understanding the project, right? So those would be really the key assumptions that you want to deal with. You also want to think about external factors. So this is things outside of your project itself and the program that you're developing, about the environment that you're in, the cultural factors that you're dealing with, the climate that you're in terms of what's going on around you, economic considerations and challenges, housing, demographics, politics, media, other things that might be influencing what's happening for your program. All right. So So these are, this is sort of the framing that is, in many cases, actually outside your control. Okay. Now, why would you care about things that are outside your control? Well, in some ways, you do want to focus on the things that you can do something about, right? But you also don't want to be blindsided by something that comes up that you didn't think about, right? So if something is changing rapidly in the context where you're working, well, that could throw off your project. If something's dramatic happening in terms of financing or something like that, that's really important, right? So thinking carefully about what factors there might be that you can't necessarily control is important. So to some extent, sometimes you can have some ability to influence these factors or protect yourselves from the impact that these factors might have on your program, right? And in doing so, you would think about what are the risk management strategies that you can use or develop, right? So how can you set up your program so that if any of these external factors actually come to pass or come to influence your program, that you would be resilient in the face of them, okay? All right. So in terms of writing, here again, we're focusing on the key ones. These are the ones that are most likely to have an impact on your program. So again, just some examples of what that might look like. All right. So we've talked a lot about those sort of preparatory elements for thinking about this. All right. These should give you some ideas about what might be feasible in terms of a program, what is needed, what is preferred by your institution. And when we start coming towards creating an actual program, understanding these elements really helps keep us honest and keep us on track for creating something that's likely to be successful. Again, by planning, by thinking carefully about this, you dramatically increase the likelihood that your program will achieve the outcomes that you want. All right. So here is just an example of the inputs, outputs, and outcomes for a logic model. All right. So you can look down this list, and inputs are essentially what we invest. So staff, volunteers, time, money, etc. Outputs are the activities that we do, and these are the things, the projects that we're taking on with our program. So workshops, trainings, facilitation, communications, other things that we're doing in our project. All right. And then participation is who we're engaging with, who we're reaching. And these often are stakeholders. These are often the people who are running the program. They're also often the people who are going to be impacted by the program, the participants in the program, right? So these are the elements there. And then we have the outcomes that we're hoping to get from what we've designed, our activities and that participation and what we put into it, okay? So in the Wisconsin model, we break it out into the short-term outcomes, the medium-term outcomes, and then the long-term outcomes and or impacts. So these are, again, are now thinking about the big picture impacts long-term of this. And we'll talk more about that in a second. And within that chart, it sort of breaks down the different elements that you might think about having in each of those in terms of early, medium, or long-term type effects. Now, there's something I want to note about the logic model, is that although it's directional, we go from the situation to our outcomes, right? It actually isn't necessarily the case that it should always be followed in this directional way. Particularly for this stage where we're designing the actual components to a program, it's actually usually favorable to think about your outcomes that you want, which are going to be based upon your priorities and your understanding of the situations, before you actually develop your activities and participation and inputs, right? Because the outcomes should actually determine what your program is, right? If your program doesn't achieve the outcomes that you actually want to see, then it doesn't serve your purposes very well. So you can look at a situation and decide on a program that you happen to like, but understanding what the outcomes are that you need to have come out of that program actually can inform whether or not you were right about what that program should be, what those activities should be. Okay. So Before we go into sort of talking about those different elements in more detail, I just want to mention some terminology. So the first is thinking about the goal of your project. So in your introduction, as you talk about your situation, you should probably at some point talk about what your goal is. And this is essentially a basic overall statement about what your project is going to, what its aims are, what its purpose is. And what you plan to get out of it in terms of that goal, right? The objectives, that's a term that's often referred to the specific subcomponents or elements of that overall goal. And that's essentially getting at how you're going to achieve what you want with your program. Now, with the Wisconsin model, they prefer to use the term outcomes. And this is sort of concrete results of a program. So these are the things that come out of that program, which are similar to objectives. We're going to be using outcomes, but here we're just being very concrete about what we expect, what we will get from doing this thing. And being clear about this, again, is really important because that's what your stakeholders are going to care about. They want to know, if they do this thing, what they're going to get from it. All right. So like I said, it's valuable actually to think about your outcomes necessarily before you nail down your activities, even though your activities are done before you achieve your outcomes, right? Again, to guide those other elements, right? So your outcomes really should pair relatively well with your priorities and your situation assessment, right? So the outcomes are what you're hoping to achieve in relationship to the problem that you're dealing with, right? Also, there's many different ways that you can deal with a problem, and your priorities are what determine what outcomes are going to be most important as you go forward with that project, right? So, in particular, priorities, sometimes priorities actually look a lot like the long-term or the outcomes that you see. There's different ways of sort of evaluating outcomes that you might be interested in. They're kind of obvious, but the outcomes that you have should be important, right? People should read them and understand that they are something that they would care about, given your institutional needs. They should be outcomes that are reasonable. So outcomes should match what you can actually expect to see from the programs that you are proposing, right? So, there's relatively few situations where you can get 100% of everything, right? So is it a reasonable thing to expect that this would occur? Is it realistic to think that would occur? And realistic is the other elements to it, right? So when people look and evaluate the program that you propose, they're going to be looking at this to see whether or not it seems like something that is valuable and something that is likely to actually realistically occur if they do this program. There's also another element to this when we're thinking about outcomes that's actually really important and also often gets forgotten, right? And these are potentially negative or unintended outcomes, right? So very often when we look at these outcomes, we're thinking about the things that we want to get from this program and that we're hopeful we will get. And I would encourage you to, of course, emphasize that, particularly in your logic model. I would put them in primarily. In the model that you present. But that shouldn't discourage you from thinking carefully about what could potentially occur that would be negative from this. And it could be unintended, right? But remember that a lot of health technologies, for example, say your intervention is around using a new health technology. Well, a lot of health technologies actually increase health disparities. Especially if they're expensive, right? So if people don't have health insurance or don't have availability to use that new health technology, well, you can actually make health disparities worse, right? Does that mean you shouldn't do this project? Well, maybe not, but very often you should still offer that new health technology. But you should be aware that this potential negative outcome could occur, right? The reason that you want to be aware of this is because sometimes you can design your plan to more effectively address this concern. And then the other element to this is if you potentially would have negative outcomes, you can talk about these with your stakeholders. And if people are critical of the program that you're potentially proposing because of these, you're actually prepared to talk about what these negative outcomes are and how you've done your best to sort of mitigate what those negative outcomes would be. Again, you may or may not want to put this in your actual logic model because you're using this as a communication tool. But you might want to put them in if it's a really important negative outcome that you anticipate occurring and that you can present as something that would need to be monitored and that you be addressing, right? So you can think about how to frame it well so it's not discouraging, but in some cases you may actually want it in that actual document, okay? All right, so you're all aware of SMART objectives or SMART outcomes. This is a tool that's used very often to talk about how to write in a way that is very clear and that increases your likelihood of actually achieving your goals. Right? So SMART stands for specific, measurable, achievable or attainable, relevant and results oriented, and time-oriented, right? So that means that when you're making a statement, it should be specific. People should understand clearly what it is. It should be something that you could actually say, yes, I achieved this, and show it using some form of data, all right? It should be achievable. It should be realistic, right? You don't want to propose things that are just outside of the scope of possibility. It should be something that people care about in terms of being relevant to the needs of the situation. And in many situations, it's nice to have some time element to this. Now, the reason that having a time element tied into these statements and these outcomes that we're proposing is they sort of keep us honest and they give us a framework for thinking about how is this actually going to roll out and occur. A lot of logic models actually don't include that time element in terms of the outcomes. Sometimes you have to update them a lot, and sometimes those exact time frames are not clear, especially if you're proposing a hypothetical or early stage program. But you should be thinking about the time element to this in terms of thinking about how would this roll out and what could expectations be for this program. All right. Now, the outcomes are broken out into three different time categories: the short term, medium term, and long term. Now, what I'll first say is that what this means actually in terms of time is going to vary depending on your project. There's some projects that are very time oriented that may be actually relatively short. So the time between the short term and the long term might be a year. So, or it might be 3 months. So if you're talking about COVID-19, for example, you might have to make a change that's going to happen very fast. And your short term might be 2 weeks from now. Your medium term might be a month from now, and your long term might be 3 months from now. All right. However, there's other projects that might be a 5-year time frame, depending on what you're trying to create. If you're trying to create a whole new curriculum, for example, and it's going to be rolling out over time, and you're hoping long term to see impacts on student success at work after they've graduated, that's going to be a fairly long-term time frame. So you'll want to actually define for yourself, for your project, roughly what that time frame is going to look like. All right, so what is short term? So short term is typically what you'd expect to see as your program is starting to be rolled out and is being implemented, in the process of beginning to be implemented. So these are sort of the early outcomes that we might expect. So these might be short-term changes to attitude or opinions or beginning of knowledge or skills related to a project, all right? And here's an example of what that might look like. Medium term are outcomes that are really referring to after your program has been rolled out pretty well and it's running smoothly. It might not all be perfect, but it's kind of it's going, all right? These might be things that we would see more in the short term. So if you have a program that's looking at influencing how people view the healthcare system, patients view the healthcare system. You might see measures that are actually, you will start to see coming in as time goes by. All right. So these are, again, sort of after the program has been implemented and is fully enacted. All right. Then you would have the long-term outcomes. And these are outcomes that sometimes you might not see until after something has been enacted for a while. All right. So here we're assuming that it's already running smoothly, but it's been running smoothly for a while. So these might be things like overall improved quality of life for long-term chronic disease patients, right? We might not see impacts on quality of life even after the program is up and running successfully for a while, but it might take a year or two before that shows up, or maybe 3 years, all right? And another way to look at this is also at the big, large-scale impact of this program. And this is helpful for communicating with your stakeholders. So often you'll use your logic model to convince people that this is worth investing in to actually do this program, or worth continuing to invest in and maintaining this program. All right. So you want to make it clear to the audience that if they do this thing, that they will have this benefit for their institution. Sometimes you can be specific about this in terms of numbers or goals, or sometimes, sometimes you will have a larger value statement. Well, perhaps not value statement, but a statement about, what benefit this is going to have for the healthcare institution that you have. Okay, so these can tend to be a little bit broader and larger impact focused. All right, so once you have your objectives, you can start to work on those earlier elements to your project. I think, you could go to inputs and participants, but I think that activities is probably the logical next step. And that's the things that you're actually going to be doing, from developing procedures to creating new educational program, etc. All right. So these are the things that you'll do, and this is going to vary depending on your project. Now, the activities that you are doing should match up to your objectives, right? So if you have certain things that you need to achieve with this program, you need to make sure that there's components there that will achieve what you're hoping to achieve, right? In terms of participation, we're looking again at the reach, who's going to be impacted by this, both in terms of who's involved in implementing the program, who's involved in sort of oversight of it, who's involved in actually being a part of that program in terms of making it happen, and who ultimately benefits from it, right? So, so you can list out those people, and this makes it clear who's going to be involved in this project, okay? And then we have the inputs, all right? So these are the things that we need in order to make your project run. So these are the money, the resources, the equipment, the people that will be involved in it, the materials that you'll need to create, etc. Okay. So, all right. So, there's a few things I want to note about these programs. Again, the goal here is to create a plan that is detailed, where you thought through it carefully and you thought about how these parts relate to one another, where it's clear and it's realistic. And developing a logic model like this really forces you to do that, okay? As you're writing this logic model, it also helps to think about what will be useful to your audience, your stakeholders, the people that you'll be talking about this with, to understand what you're trying to do. It also, again, you're going to be using this over time. So it also helps you clarify what you'd be monitoring, what you'd be looking at to see whether it's being successful or whether there's problems with how it's happening. Very often programs have to be revised regularly, right? Remember that this development process is interrelated. So as you're thinking about these different components in the inputs and the situation and the outcomes and all these different elements, they all connect to each other. And while we present the different components of the logic model as columns and lists, they sort of have relationships to one another. So an input of a clinical nurse educator, for example, might be most involved in one element of the program, which is the educational component, and might be most influential on nurses' practice, right? In terms of the participants, right? And then it might have that particular person might have the most impact on certain types of outcomes, whereas another type of input, for example, money, might be most important for, say, buying simulation tools or some other element to that program, right? So thinking of them not just as lists that you read down, but lists that you read across, and see how those different elements interrelate with one another to result in your outcomes, is actually an important way of testing your program model and making sure that you have the things in there that you need. And it's also iterative. As you think about these things and think about the different things that you need to add or subtract to it, you'll then go back and reevaluate your program model. And you'll also be doing that over time as your project evolves, right? As you're actually implementing it, because you'll find out things that maybe are working or not working that you'll want to add, and you'll be updating it over time. So that's just a primer on how we think about logic models and developing them. They are shown to be really effective and useful. I hope that that's helpful for you as you think about the issues that you're facing in clinical contexts and what you might be prioritizing to do, and then thinking about what the program is that you're going to develop and what the components of that are, and hopefully how you're actually going to make a significant change in terms of bringing evidence-based practice and quality improvement into your sites. So that's it for introducing the Wisconsin model and logic models in general. I hope that's helpful for thinking a little bit about what we're doing here and why it's important. Again, I've seen this be very, very impactful. I've seen examples of students who've gone on to do these programs and who've told me about how big of a difference it makes for them in terms of being able to successfully get buy-in for their projects and carry them out over time. So thank you very much for listening, and hope that's helpful. So take care, everyone.